today?
Hi, I was prescribed a new medication. I think it's called Lisinopril or something.
Okay. And you had some questions about it?
Yeah, can you tell me what it's for?
Yeah, so this medication, the generic name is Lisinopril, and then the one you were prescribed, the brand name is Prenavil, and it is used to reduce high blood pressure. You've had a couple of consecutive high blood pressure readings, and that is why your physician ordered it. Did they go over how to take the medication or how it works in your body?
Not really. Do I just take it orally?
You do take it orally, so it looks like you were prescribed 10 milligrams a day. So, what this medication does is it lowers your blood pressure and it also reduces aldosterone. And aldosterone is a hormone in your body that naturally raises your blood pressure, so we want to block that from happening in your body. And you can take it, you're taking it every day. Before you take it, you do want to monitor your blood pressure. And do you have a blood pressure cuff at home?
No, I don't. Where can I get one?
Okay, you can pick one up at your local Walgreens or CVS or go to Walmart. You want to take your blood pressure before you take the medication, and you want to hold it if your blood pressure is low. So if your systolic, which is the number on top, is 100, then you want to hold your medication. And you can take it without regards to food.
Okay.
So whether on an empty stomach or if you've had food already, it doesn't matter. But you do want to avoid foods that are, or potassium supplements. Do you want to avoid also any salt substitutes because these contain potassium? And if you ever are prescribed any potassium sparing diuretics, you want to let your physician know that you are taking lisinopril.
Okay. Do you think that maybe I have high blood pressure because of what I eat or drink?
Yeah, so in order to achieve the best effects, you want to make sure you keep a healthy lifestyle. So we want to make sure we stay active, that you're eating a healthy diet, and along with the medication, that's going to achieve the best effects.
Okay. I mean, I'm pretty active. I go to the gym all the time, but I drink a lot of energy drinks. Does that have any effect, do you think?
Yeah, we might want to cut out and increase our water intake instead, and let your body like naturally take care. You do also want to watch out for certain side effects that you want to be aware that can happen.
Okay.
So it can lower your blood pressure a lot, and you might start feeling a little dizzy, lightheaded. So you just want to sit down, drink some water, and rest for a bit. You also want to be careful when you're switching positions. So from laying to sitting or sitting to standing, it might cause something called orthostatic hypotension, where your blood pressure will drop significantly when you're changing positions. So you want to do this slowly. You also might experience a dry cough. A lot of patients find this difficult to deal with, but you do not want to discontinue the medication on your own if it's becoming increasingly difficult to live with the dry cough. Talk to your provider, and then you can talk about switching the medication if need be. There could also experience hyperkalemia. That's where your potassium in your body is raised, and you might not necessarily feel the symptoms of hyperkalemia right away until it's extremely elevated. But if you start feeling like muscles are tingly or some weakness, that could be some signs of hyperkalemia. Another side effect could be angioedema, and this is like the swelling around like your mouth, your tongue, and this would be a medical emergency, so you want to make sure you get help right away for that. Any other questions regarding medication?
Um, I mean, I take a bunch of supplements for the gym. Do you think I should maybe cut back and just go more natural, just in case it has any interactions with lisinopril?
Okay, you can talk to your provider to see if anything specifically is contraindicated for that medication. But what you could look at is if they contain any potassium.
Okay.
And if they do, then you might want to switch to something that does not have potassium in it. You don't want to add any potassium supplements.
Okay. And the doctor also mentioned something about eating a heart healthy diet. What does that mean? Like, what should I eat?
So we want to cut back on some sodium, so not so much table salt. We want to make sure your fat intake is lower. You want to make sure you're working on your cholesterol levels as well. Drink plenty of water, and make sure you're always adding your fruits and vegetables to your diet.
So basically, drive by McDonald's when I see it instead of stopping.
exactly what not to do.
Okay, perfect.